My name is Danielle Menendez. I am an RN. I am the Director of Nursing at Banyan Stuart. Detox is an important first step in treatment because the client goes through that period of withdrawal. Oftentimes, withdrawal leads to relapse if we can't provide comfort measures to make the client more comfortable during that process. The most dangerous part of trying to go through the withdrawal process without medical supervision is seizures, especially if you are alone or in an environment that's not safe and somebody's monitoring you. Oftentimes people will have seizures, fall, hit their head, have an injury that could subsequently lead to death. Aspiration is something that happens very frequently, especially with our older alcoholics that have problems with COPD and emphysema. Their breathing is already compromised. So a lot of times they will aspirate, take fluid back into their lungs, and then they can't breathe, so their lungs are not fully expanding. These people go into respiratory arrest. If it's not caught in a certain amount of time, it starts starving the brain of oxygen. So these people are at risk for heart attacks, seizures, stroke, a couple of different things that can happen. Called intensive level of care. This is commonly used for our clients that have had a short relapse or have a medical issue that is compromising their detox as well. We also offer residential level of care and PHP level of care for specific clients. In the detox level of care, that's the beginning of the process. That's when we will get the client safely off of the substance that they've been using. They will be assessed for necessity and put on the proper medications to start getting them off of whatever substance they are using. Detox for alcohol, opiates, benzos, and other substances, but those are our primary ones. We detox clients using Subutex, Ativan, Librium, Klonopin, and occasionally a few other medications, but it's on a case-by-case basis. Each client's protocol is specifically tailored to how much they've been using and for how long. Our intensive level of care is often used for our short relapses, clients that may only require a day or two of medication assistance prior to stepping down to residential level of care, or if a client comes in, say, from a hospital or from a Baker Act, where they're not quite stable, so they can't go off property yet for outside activities, but they do not need to be on detox meds. So it's kind of like a holding place between detox and residential. One of the biggest things that our nurses do to help keep clients safe and comfortable during detox is to monitor their vitals throughout their stay. They check their blood sugar if they're diabetic. They do routine rounds on them, especially if there's a safety issue. And a lot of people think when you say safety issue that you're thinking of suicide watch, but we also have clients that are at risk for falls, patients that are at risk for seizures, patients that are at risk for aspiration, which is, when you swallow fluid back into your lungs that can cause you to stop breathing. These are things that can be life-threatening, and that's the importance of coming to detox that's medically monitored. So the nurses do rounds on patients as well as the techs to monitor for these signs and symptoms. This is where the client generally goes through post-acute withdrawal symptoms. This is where comfort medication is key. This is where a lot of clients tend to go home, and this is where relapse happens because they're still feeling sick and they don't have any medications to help bridge that gap to getting to past that stage.